interesting patient who had a previous elbow fracture. The fracture occurred at the level of the distal humeral shaft on the lateral aspect of the humerus. And after the fracture, the patient developed some paresthesias and sensory symptoms over the posterior aspect of the forearm. I placed the probe at the level of the spiral groove to identify the first landmark. This is the radial nerve. You see the radial nerve is here. This is the humeral shaft. If I go more posteriorly, I see a small artery. You see the pulsation of the vessel here. This is the deep humeral artery. And then in the middle, I see some fascicles between the artery and the main trunk of the radial nerve. And they belong to the posterior cutaneous nerve of the forearm. So the radial nerve then deflects, it moves anteriorly, passing across the lateral intermuscular septum. If I follow the posterior cutaneous nerve of the forearm down, I see the arteries here, I see the fascicles of the nerve diverging here. These are terminal branches. Some of them migrate in the subcutaneous tissues, but other branches go more posteriorly on the side of the triceps muscle. And when I follow these branches down, I see some fascicles in this area. I realized that when I approach the elbow, they become swollen and hypoechoic, as you can see here. And more distally, they become even more swollen now. They infold within the bone. So this means that the nerve was entrapped at the level of the humeral fracture. And going down with the probe more distally, I see the nerve emerging from bone and moving again in the subcutaneous tissue. So this is an example of encasement, of bone encasement of one of the divisional branches of the posterior cutaneous nerve of the forearm. I try to orient the probe now in the long axis of the nerve, and I see the nerve passing in closer position with the cortex of the humerus and then enfolding within the fracture. More distally, I see the nerve emerging here. Again, it appears very swollen distally, and then descending the forearm.